So I want to show you a cool case. As you know, we do a lot of fat transfer. I've been doing fat transfer for over 15 years. I love it. It's a great adjunct procedure, especially to surgery. So I do a lot of it when I'm doing lifting surgery, blepharoplasties, but I also do it as a standalone procedure especially for patients that need a lot of volume or volumization of the entire face. I think it's a lot more of an economical way to add volume to the entire face as opposed to something like filler, which can get very expensive. So I want to show you a patient. We did a full face fat transfer procedure. This is a patient in her early 40s, was just feeling like she was aging. And when we saw her, the main thing I saw was there's really no tissue to be lifting, but she has a fair amount of volume loss. So when we look at her before images, from top down, we see volume loss in the temples, we see volume loss in the brows, in the upper eyelid sulcus, the lower eyelid tear trough area. There's volume loss in the junction between the high cheek and the buccal region, causing more of a kind of a masculinized sharpness here. And then we see volume loss around the chin and the mouth. So what I would call pan-facial volume loss. So we talked to her about biostimulants, fillers. Ultimately, she decided on a fat transfer procedure, which was great. So we're able to go to surgery for a quick procedure. We harvested a fair amount of fat from the outer thigh, and we combined it with PRP to increase take rate. But we added volume. You can see in the temples, the brows, the upper lid sulcus, the lower eyelid tear trough region, the cheek. We added a fair amount to address this hollowing in the buccal region, and then around the mouth. And overall, it's just a softer, more youthful look. So when we look at her different images here, you can see, you can't really tell what is done, but she just looks more youthful. The skin has just a nicer sort of glow appearance to it. A lot of that, I think, is related not only to the volumization, but the adipose-derived stem cells that we find in fat grafting. I use a combination of both microfat and nanofat when we do fat grafting. Nanofat I like to use more around the mouth. Microfat I use in more different areas of the face. So anyways, it's a great procedure. We do a lot of them. I think it's a nice way as an adjunct to surgery, but also as a standalone.